This, where the World Health Organization calls it the most devastating injury, of course, dealing with childbirth. And now a report by Amnesty International called "I Never Thought I Could Get Healed from This" highlights the physical and psychological trauma experienced by both women and girls suffering from obstetric fistula, this in Zimbabwe. Now, the condition is a hole in the birth canal caused by obstructed labor, and it results in the continuous and uncontrollable leaking of both urine and faeces. Many sufferers and rather end up facing stigma as well as lifelong emotional scars. So it's important we talk more about this so we can educate more women as well as young girls. I'm joined by Amnesty International researcher Ms. Mandipha Machacha-Diale. Ms. Machacha-Diale, thank you so much for your time. Quite a revealing report, I have to say. I think when I read it, I went, ooh, we need to have this conversation so more pregnant women and girls can be made aware and make better medical decisions if they are enduring this. So let's talk about this. Some of the child, birth-related injuries that are, that pregnant women and girls are at risk of. What do they include?
Maternal morbidities can range from things that are very minor, or what people consider minor, like perinatal tears, and episiotomy, which is when they cut you when you're having a natural labor, to postnatal depression, as well as hemorrhoids, but it can actually get a little bit more serious to, bleeding, some of which can lead to maternal mortality, which is when women die as a result of childbirth. Obstetric fistula is a particularly devastating one because, as you've mentioned, it has, very lifelong and challenging consequences, which result in, stigmatization, discrimination, as well as, a lack of economic capacity, because a lot of women that we spoke to during our research weren't able to work because of their condition.
Yeah. And those are just some of the physical and psychological, results and, obviously consequences we're seeing should you suffer from this. But, let's talk about then the choice that I'm reading from the report that, more and more women are sort of choosing home-based deliveries as opposed to public health care. Why is this?
Well, I think that's really what the report is trying to highlight. There's choosing and then there's choosing.
Yeah.
Because, if you're in a situation where, due to certain traditional or religious views, you would be more likely to have a home birth, or because you're very young and you really have no information on any sort of decision-making agency. For instance, a lot of the women that we reported on were in between the ages of 15 and 17 when they got married. And so generally people like that aren't really in a position to be able to make a decision about where they have their babies. And so if their mother-in-law says that they have to have the baby at home, then they're going to have the baby at home. But there's many other barriers as well. There's economic costs. Despite the fact that the Zimbabwean government has stated that maternal health care is supposed to be free, this is not necessarily the case, because during our research we found out that even in public health care facilities, women were being made to pay for maternal health care, both registration fees and fees, in order for them to access antenatal and postnatal care. So some of the costs are quite high. It can be anything between $150 to $500, and these costs are very prohibitive for many, many people. There's also transport barriers. There's a huge transport and ambulance crisis in Zimbabwe. A lot of women who suffer from fistula, it's because they encountered delays in getting access to quality obstetric care. They didn't have the money to have to hire a car to be able to take them to the hospital, or an ambulance wasn't available at the time. And sometimes even at the point of care. So sometimes women even get to the hospitals, but the hospitals are so under-resourced and dilapidated that they're just not in a condition for them to be able to receive the kind of care which they need, which is usually a cesarean section. So there might not be somebody who's specialized. And so, there's all these things that people say that it's women choosing to have home births, but it's not necessarily a choice when, for instance, you're so young that your mother-in-law makes the decision for you, or you don't have the money. Or you feel that the healthcare system is so dilapidated that
and I want to just jump in there, speaking of the health care system, because one would assume that because fistula is as a crisis, for women who experience it, women who enjoy it, especially even young girls, like you say, that don't have a choice. What are the interventions in place from a medical perspective, from the healthcare sector, to ensure that they do avoid it, if it is indeed avoidable, but also that they can intervene should a pregnant woman, or even a pregnant young girl have to, or rather, be diagnosed with fistula?
Yes, I mean, the main way in which you can avoid fistula is by having a cesarean section, because women who experience fistula are those who experience what you call an obstructed labor.
Yeah.
And this usually happens when there's complications in the labor. So usually a woman will be in labor for 24 hours. Usually, I mean, my second baby, I was in labor for 24 hours. So, but usually women will be in labor for 24 hours. But women with fistula will be in labor for 3 to 4, and we've documented women who were in labor for almost 6 days. So they were the kind of people who needed to have an emergency cesarean section. And that's really the main way to prevent it. But due to the barriers that we spoke about, choosing home births, not having access to hospitals, women then end up experiencing this prolonged labor, which then results in fistula. The main way in which you can treat fistula once it's there is by having what you call a surgical repair of fistula. And the success rates are quite high. I mean, there's a recent study that's come out in Zimbabwe that they're 96% successful. And throughout the world, the success rates are between 90 and 100%.
All right.
So women have to undergo the surgery. It's usually maybe 2 or 3 surgeries. And then they're generally repaired and able to live their life normally.
All right.
The problem is, this is a very skilled surgery. Not a lot of people or doctors in Zimbabwe have the skill. Not a lot of doctors in Zimbabwe want to have this skill because generally fistula affects poor people. So they really wouldn't have the kind of market that they would want.
All right.
So they would rather be doing like more high-income surgeries than fistula. But the government did.
Yeah. Unfortunately, we have to leave it there due to time, Ms. Mandipha Machata-Diale. But thank you so much for highlighting this issue. There's a lot to go through here. Wish you had more time because it's quite informative, so that more women can be aware. Amnesty International researcher Mandipha Machata-Diale, thank you for joining us.